There are several service agencies that provide aid and assistance to older Memphians. Tonight on The Best Times, we profile one of them, Meriton. Cataracts are just one of the vision-impairing diseases affecting us as we age. Tonight, you'll get more information on protecting your vision. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people since 1964. Additional funding is provided by the members of WKNO. Thank you. Hello, I'm Chris Hardaway. Welcome to this edition of The Best Times, a series that looks at life after 50. There are many organizations throughout the area that provide services to our older citizens, particularly those who are the neediest. So it's ironic that surveys show that those who have the greatest need often are unaware of the existence of these organizations and the services they provide. One such organization is called Meriton. Their goal is to provide independence and a sense of well-being to their clients of all ages. Tonight on The Best Times, we explore the range of senior services offered by Meriton. Alma Jean Blankenship is a client in the Meriton In-Home Personal Care Program. Meriton staff member Phyllis Taylor visits with Alma Jean several times a week. She provides in-home, non-medical care, helping her with basic household and personal chores, things like washing her hair or making her bed, or just sitting and talking with her. Alma Jean says Phyllis is her best friend. The goal of Meriton's Homemaker program is to keep older citizens in their homes, living independently for as long as possible. And that gives Alma Jean a sense of well-being. Betty Wiseman is answering the phones on the front desk at Meriton's offices. After a 20-year career in accounting, she thought her days in the workforce had ended. But Meriton's job training program for low-income, unemployed seniors gave her the skills to find a new job. Enrollees in the program receive paid, temporary career training experience at community-based organizations and public agencies. Betty's Encore career began when she was hired as the receptionist in 2016. Now in her mid-70s, Betty gets up and goes to work every day. And that, she says, gives her life purpose. To find out more about Meriton services, I've invited 4 members of the executive staff into the studio. Let's start off with the basics. What is Meriton?
Meriton is a health and social services nonprofit. We were established in Memphis in 1961. We provide services throughout the Mid-South, primarily though focused here in Shelby County. We provide foster care services, and we provide a lot of services to the elderly and people with disabilities.
Well, just give me a list of the services
Sure,
we provide,
absolutely.
and then we'll talk in detail.
Right. So for adults with intellectual and developmental disabilities, we provide residential supports, helping people live in the community and also interact in the community with day services. Some of our services to seniors include our senior employment program for people 55 and older. We have in-home services that are skilled in-home services, so that's nurses, occupational physical therapy, usually for an acute episode of illness. And our other in-home services are home and community-based services. So those are services to veterans, to people that live with AIDS and HIV, to Choices members that have TennCare, and also to people through adult protective services, and additionally we provide services through coordinated response to elder abuse. So we provide a variety of services to people that are victims of elder abuse.
Now, are there eligibility requirements?
There are, but it depends on the program.
Okay.
For instance, the home health program is more of an insurance reimburse, so Medicare, Medicaid, private insurance. The HOPA program, Housing Opportunities for People with AIDS, there of course the requirements that they're living with HIV and AIDS. The Senior Employment Program is people over 55 under a certain income. Our Choices program is for Medicaid eligible, TennCare eligible clients, and the Veterans is through people that have services through the VA, and then we also have options for people with private pay and other insurance payers as well.
All right, well, let's start and talk in detail about some of the services, specifically the ones for seniors. So let's talk about the in-home services. What exactly does that mean when we're talking about in-home services?
Well, you know, one of the reasons why the in-home service program exists is to keep individuals in their home, in the community, and out of institutional care, out of nursing home care. So for us, we go in and provide those adaptive living skills that sometimes you and I take for granted: meal preparation, bathing, dressing, the personal care things that clients would often need.
The core elements of living.
The core elements, actually, of living. That's correct. We also provide transportation services for people to go to doctor's appointments, so a variety of services.
And do you have to qualify for those services? And what are the qualifications?
Again, it depends on the program. For an individual with HIV and AIDS who qualifies for our HOPWA program, we can go in and help with medication management. We can go in and help with meal preparation. In that program, we're assisting not just the individual, but if they have a family, we're also providing support for that family as well. For our other programs that serve mostly an elderly population, the qualifications vary. Adult Protective Services, if the individual's been referred through APS, we can go in and then provide those additional services. For individuals that are private pay, they tell us what they need, and so those eligibility requirements differ between programs.
So a wide range.
Yes.
In terms of requirements.
Yes.
Now, how does home health differ from in-home services? Sounds like almost the same thing.
It does sound like almost the same thing, but it's a little different. Home health, what I do is basically a skilled service. So we would get people out of the hospital, out of rehab, out of skilled nurse facilities. And we do skilled services, and that being nursing, physical therapy, occupational therapy, home health aid services, speech therapy, yes, PTOTST. And so we go in, and our goal is to keep them from going back to the hospital, to get them acclimated back into their home environment, to educate them on what maybe sent them to the hospital in the first place, whether it was their diabetes or their congestive heart failure. So it depends on what the doctor's ordered, because we work directly under a doctor's order. So we go in, educate the family, educate the patient, in order to keep them from going back to the hospital and get them living on their own again. It's an intermediate service. We don't stay in there forever. Not long term, not at all. So we go in, get our job done, and get back out. So that's what we do. We work under Medicare, under TennCare.
Yeah, I was about to ask about that. About are there eligibility requirements?
Yes,
Okay.
and like under Medicare, the rules are you have to be homebound. That's one of the major rules under Medicare. TennCare, not so much, but you have to have those, you all have to meet the eligibility requirements under the payer.
Okay.
And there's the medical necessity component.
Right.
Again, like she said, it's an acute episode of illness where we're working with the physician to keep someone out of or from going back to a facility, whether that's a hospital or a nursing home.
Right.
And we have senior employment and training. That sounds good.
Yes.
What do you do?
Well, we work with about 50 local not-for-profit agencies. These agencies serve as training sites for our participants in the program. The program is designed to help those individuals that are 55 years of age and older who want to get back into the workforce do just that. So they train at these agencies to help them build or refresh their skills, learn new skills, and so they can apply that towards the job that they want.
And so they get training on the job, so to speak.
On the job training,
Now,
yes, sir.
what about eligibility for that program?
Well, one, of course, is the age. They must be at least 55 years of age or older. They must live or reside in one of the counties that we serve, and we serve Shelby, Fayette, and Tipton counties. And according to the poverty level, their income cannot exceed 125% of that, or that's roughly $1,300 or less a month.
Okay.
Now, the majority of our program participants earn way less than $1,300 a month. So it's a really, really necessary program.
And then there are a couple of other programs.
Right, right.
Let's talk about CREA before we go too far. Because
Okay, sure.
The Coordinated Response to Elder Abuse, which
Right.
is an effort that's been ongoing for several years. We've talked about it many times on this show.
Right. It's a collaborative effort that we've had here in the Shelby County area for, gosh, I think we're going on about 4 years now. And Meriton works with the Family Safety Center, with the Memphis Police, Shelby County Fire Department, several other nonprofit agencies. And what we do is we provide an additional layer of case management services. The Family Safety Center gets the initial referral, but they may refer to our nurse, who also coordinates for long-term housing. But our nurse will go out and do an assessment in the home, which can sometimes help with the prosecution later, determine if what their needs are that might help them live more safely in the home. Because sometimes a lot of the elder abuse is what I like to call passive neglect, that people are being neglected, but not intentionally, but because their caregivers don't understand the resources that are available. So we may coordinate those resources, and it might be that there's the nurse coming from Lynn's program from the Skilled Home Health, but we also incorporate homemaker services as well, so that we have that basic supports while we engage them with other community services. Sometimes there's an emergency housing need, and we'll coordinate that, whether that's at a long-term nursing care facility. Sometimes it's a hotel, depending on how independent that person is. So it's a big need, and we've noticed just here in the last couple of weeks that it's just grown almost overnight.
The need has grown?
Yeah, it's feast or famine, I think, with referrals, and the referrals have just, come.
I think the word is just really spread about reporting, and we've had several cases over the last couple of weeks. So I think everybody's just become aware of reporting elder abuse. And the sad thing is, probably we don't touch 60% of it
Oh,
out
no.
there.
I'm sure we don't. I'm sure we
Not
probably
even
don't touch
near that.
90%.
No.
Right,
Yeah,
right.
yeah.
But it's sad, but yeah, we've had an influx of several cases.
Now, you also do foster services
We
and
do
disability.
foster care services as well. We do foster care services in Arkansas and also in Georgia. And we do services to people with intellectual and developmental disabilities, again, supporting them to live and interact in the community. And then we're also part of Driving the Dream through United Way, where we're a care coordination hub. So we have a program where anyone from the community can call in and say, I have somebody that has an issue, and we're looking at intergenerational homes. And it might not be that we're providing the service, but we're providing a point of contact, and we're helping people navigate the system. Memphis is blessed with a number of nonprofits. We have a lot of agencies out here doing a lot of great services, but navigating the system, knowing what nonprofit agency does what, navigating the healthcare system, navigating the insurance system, it can all be a daunting challenge. So we have those case management services at Meriton where we can accept referrals from anyone in the community, and we will help them get in contact with the services that they need, regardless of whether or not we provide them.
Well, that gets into a little bit of what we talked about earlier, the awareness, the public awareness of organizations like yours and some of the other organizations that are out there and available. I mean, do you get feedback from people who come in and say, I had no idea that this existed?
Yes, yes. I mean, I'm sure you.
Often received a phone call from a gentleman just the other day, needed help for his mom. He had no idea where to start, and a part of that was our sending a case manager out to conduct an assessment. And so we will do an initial assessment, and one of the things that we're offering now as a part of being a United Way hub is what's known nationally wraparound case management services, this holistic approach to providing services to individuals and to families. And when he called, it wasn't that he necessarily needed in-home support services. He wanted his mom to be able to get out into the community and what other senior care centers out there would be available while he was at work. And so we helped him fulfill that need just by providing information.
He just needed the information.
He
That's
just
all
needed
he
the information.
Which, and of course, the trick is knowing where to find it.
Yes.
And one of the beauties of the senior employment program is because we do work with about 50 other nonprofit agencies. The employers, the employees are paid through the grant funding and the money that we raise, and so they're working 20 hours a week at MIFA or at the food bank or at the Red Cross, but that's workers that they don't have to pay for.
Right.
And so they're getting that on-the-job training, but at the same time, they're providing a service to that nonprofit and a service to the community. So it really is a great example of how we can all collaborate together. And then we're helping that person learn a skill that ultimately they may be hired by that nonprofit, or they've gained the skills to be hired elsewhere in the community.
How great is the need? Do you feel like you're meeting the need in the community?
I think we're scratching the surface. I
Right.
think it's fair to say. I think that there is, again, a lot of need for knowledge. People don't know what they need until they know that it's out there, right? And I think there's a need for there to be a one-stop shop or a few more one-stop where people can have that point of entry to the whole
gateway,
system.
yes.
Exactly. Because it can be very, very confusing. Our population continues to grow older, and we're also dealing with a significant poverty issue in Shelby County. That's not news to anyone. And with poverty, with economic disparity, comes health disparities. And so people that are in poverty are likely to be more sick. And so I don't think that we're even beginning to really touch the opportunities that are out there.
I just think that, you know, one of the values that Meriton provides is we address all of those social determinants of health. You know, we have home health, we have employment, we have in-home support services. These are all of the things that people need in order to be successful in their own lives, and Meriton does that. We provide those opportunities. We address a number of those social determinants of what good health looks like, and that's the only way to bring people out of poverty. The two are connected. Good.
Well, let's look into the future, because if we're talking about a need that is difficult to meet right now, well, there's going to be more old people in the future,
Right.
a lot more. Poverty situation, I don't know that we're going to be able to lift that many people out of poverty here in Memphis. So what does the future look like?
Well, I think that we have a twofold challenge. We have an increasing population we need to serve with the decreasing number of people that are able to do that. We have a workforce challenge. Unemployment is a wonderful thing, but it also makes it a challenge to find the caring, compassionate level of people that you need to provide these direct care services. So as we focus on services, a key component is focusing on our workforce. And again, I go back to the senior employment program and tapping into the seniors that are able to get out there and work and to help us provide supports. But we've got to educate our youth that are coming out of schools right now and giving them options and opportunities to provide direct care as well, because we are not going to be able to provide the service without the workforce.
Well, to close out, tell me how people can contact Meriton.
Well, they can contact Meriton via our website, which is meriton.org. The kids tell me now we're not supposed to say the www, right? So it's meriton.org. There's a list of all of our services. They can call by phone, 901-766-0600. Our receptionists have a large amount of knowledge, and they're great about passing on to the appropriate program. Any other thoughts on ladies?
I think just in terms of folks contacting us, even if you don't know that you need the service yet or you don't know what service you need, call and we can help you navigate through whatever that need is.
And I want to reiterate that even if it's not a service that we provide, we want to connect people with whomever in the community can provide that service.
All right, well, I'd like to thank all of you for being on The Best Times and educating us about Meriton.
Thank you.
Thank you.
Thank you.
If you'd like more information about the range of services provided by Meriton, contact their offices or visit their website. A few years ago, I began to notice a blurring in my left eye. It was like looking through a fog. Over the course of the next 3 months, the fog got thicker, and I went in for an eye exam, which revealed what I already suspected, a cataract. By age 65, 1 in 3 Americans has some form of vision-impairing eye disease. Cataracts are the leading cause of low vision, affecting about 40% of people over age 70. And age-related macular degeneration is the leading cause of blindness for Americans over 50, which makes it a good idea to keep an eye on your future. How do our eyes change as we age?
First and foremost, that affects 100% is difficulty reading. Need for bifocals, need for multifocals, need for a second pair of glasses. That's just a normal aging change, but it's something that will hit every single person, which means that over 90% of patients over age 50 have some need for spectacle correction or contact lenses or something.
How do cataracts develop, and are they treatable?
As the cataract starts to develop, it starts to turn yellow, which is interesting because if you look at a newborn baby, their lens inside their eye is so crystal clear and it's almost impossible to see. About age 50 and 60, it's almost as yellow as a Post-it note. And if untreated at age 80, it's about as brown as wood. Cataracts are treatable. Treatable better today than any other time before. In fact, it's one of the easiest conditions to treat in aging. Surgical correction with an implantable intraocular lens is restoring patients' vision on a daily basis.
What are the symptoms of macular degeneration?
It affects vision seriously. The best way I could describe it is if you're sitting down, you're looking straight ahead, take your fist, put it right in front of one eye, close the other eye, and that's what you see with macular degeneration. Wherever you look, that's where you can't see.
Can macular degeneration be cured?
The best news is in the past several years, 5 years for example, there have been some treatments via injection which have almost eliminated the wet form of this disease. We see it less frequently in the last several years than we have seriously over the last decade or two, which is fantastic. Meaning that the majority of patients today are dealing with the dry form of the disease, which is much less disruptive of vision. It'll still have an effect, but not drastically like it does in the wet form.
What is glaucoma?
Glaucoma is also one of the leading causes of blindness in the United States, and it is the #1 cause of blindness in our African American population in the United States. Glaucoma is historically known as a disease of high eye pressure in the eye. It's a disease where the optic nerve that allows us to see is affected adversely by this higher eye pressure, and over the course of time, slowly that nerve becomes eaten away and our vision becomes eaten away. Glaucoma is a troublesome disease. It's troublesome because it's highly treatable, very, very successful in a large percentage of patients. The problem is until very late in the disease course, it's asymptomatic.
How can we protect our vision?
Routinely, go to the doctor, get your eyes checked as an example. Just make sure you leave with some good news. You don't have X, Y, and Z. If on the flip side you get some bad news, at least feel rest assured that the quicker we can treat, in almost all cases, the better you will be.
What does the future hold?
Technology is our friend, even for patients who have suffered some vision loss. There are tremendous amounts of technology to help patients deal with the vision they have remaining. In terms of medications, powerful change. From topical medications to injectable medications to surgeries with robotic surgeries, laser surgeries, the future is incredibly exciting. It doesn't necessarily mean we're going to find a cure for everything, but it means that the treatments will be much more tolerable, safer, easier to withstand, faster acting, and that's with all the diseases we've talked about so far.
If you'd like more information about your vision, go to the website of the National Eye Institute. Want more information about life after 50? Go online to watch more shows and find more resources. And send us your feedback and story ideas to besttimes@wkno.org. That's all for this edition of The Best Times. Please join us next week for more stories about life after 50. Until then, I'm Chris Hardaway. Thanks for watching. Good night. Funding for The Best Times is provided by the Plow Foundation, striving to do the greatest good by helping the greatest number of people since 1964. Additional funding is provided by the members of WKNO. Thank you.